The Korle Bu Renal unit has been closed to outpatients since May 2023. It's been closed because the Korle Bu Teaching Hospital say they owe the company that supplies them the medicine used in the treatment of kidney patients a sum of 14 million Ghana cedis. Now, what we know is that because of this amount that Korle Bu owes, they had increased dialysis treatment from 380 Ghana cedis to a little over 700 Ghana cedis. There was a public outcry over the increment of the fee, some saying that it was sheer wickedness for Korle Bu to have increased dialysis to almost about 100% increment. However, Korle Bu management say that they need to increase the dialysis costs to be able to offset the 14 million that they already owe this company. Since that time till today, November 6th, 2023, the renal unit has been closed to outpatients. However, we do know that the renal unit is open to inpatients at the Korle Bu Teaching Hospital and those in critical care. So they can still access this unit and receive the treatment that they need. The Renal Association have been crying out that this critical care that they need, or the critical services that they need at the center, which is not open to them, is affecting their livelihoods, is affecting them on a daily basis. Because if you do not have the money to pay for other services in private hospitals, in private clinics, then you will die. They have told us that the death toll of people within their association has increased from 12 to 19, and it continues to do so on a daily basis. Parliament has summoned the health minister to come and answer critical questions as to why this dialysis center remains closed.
Is to appear before us on Thursday, 9th of November 2023, to come and brief us on the closure of the Renal Unit Outpatient Department and the upsurge of kidney-related problems in Ghana. I mean, the minister should come and tell us something. Almost everywhere, people are talking about the kidney-related problems. He should come and tell us if the NHIS issue can also be captured in relating to kidney-related issues. I mean, he should come and tell us and to the extent the whole nation. So that is my directives.
This is still the Citi Newsroom on Citi TV. We're here at the Ministry of Health to get clarification as to why the renal unit remains closed despite a directive from the Ministry of Health for it to be opened immediately.
Korle Bu has taken note of that. And so they even indicated that by close of day, that is today being the 6th of November, the place will be open. You and I know that a place that has been locked up for a long period, putting it up or opening it cannot be done that immediately. They need to put up a lot of measures, testing of machines, making sure that the place is in good shape. So let's give Korle Bu the benefit of the doubt. And I know, and I'm very sure from the directions or from the communication that I've had with Korle Bu, I'm very sure that by course of the day, Korle Bu would be able to open the place for accessibility. If in the unlikely event they are not able to open, then the public will know why they will not be able to open and the reason. But we know that the minister's directive stands and they will be able to perform their duties as well.
Let's talk about the money the Korle Bu owes. They say they owe 14 million Ghana cedis. Does government or does the Ministry of Health plan to help them offset that bill?
Korle Bu is an agency under the Ministry of Health. So Korle Bu owes an amount of 14 million. How realistic that is, it depends on what is before the ministry. But what I know is that the Honorable Minister, Honorable Kwekwa, has assured that whatever debt that the government needs to intervene, government will be committed to. And he even assured the CEO that they should make the proposal, they should submit it so that he can take it for cabinet consideration. There have been a number of stakeholder engagement between Korle Bu Cabinet and the Ministry of Finance, who are keenly considering taking decisions on some of those things. It is based on those assurances that we have, that the minister have directed that if you have all this assurance that this is what is going to happen, not the new debt, but the old debt that we are talking about. Going forward, these are the plans that we're going to put in place so that we don't increase the debt. Are you getting it? We already have some outstanding debt that we need to pay. What are we going to do so that we don't increase the debt? All those things have been taken care of. That the minister and the chief executive have sat down one-on-one. They've done a number of engagement. And we are hopeful. That is why we are very sure that Korle Bu is going to comply.
We will be speaking to the Renal Patients Association on their position as to how this continues to affect them on a daily basis.
I can say on authority that I have received a call from the unit about 2 hours ago that they are just putting 1 or 2 things in place, and then we should do our labs. Since it's been 5 months we've not been at the unit, they are not sure of our condition. So do your labs, bring, and then they are hoping by Wednesday or Thursday they will start officially to the OPD. So we are praying that, as you said, things will work out like that for us.
If indeed they do open, what kind of relief will it bring your heart?
My dear, a big relief. But you see, the problem is bigger than what we are talking now. The problem is bigger than what we are talking. And I hope this conversation does not end here, as they say they are going to open. It's bigger than what we see. The 380 they are charging, a company called First Sky was paying for almost about 250 people patients. Yes. So the 380, it's not anybody who can have money to pay that 380. Most of the people are supposed to do twice a week or 3 times a week. Let's say twice a week. 380 plus 380, that is almost 700 and something. So you can imagine. So not all of them. So the conversation is big. And now, Korle Bu also is saying they are owing this 4 million. As to how the money will be paid, we don't even know. The presidential advisor on health, Dr. Nsia Asari, told us on Joy News that they were going to pay the money. That kingdom come, we've not heard anything. So if now they say they are going to pay, we thank God. But like I said, the problem is bigger than what we are seeing now.
Meanwhile, management of the Korle Bu Teaching Hospital Renal unit has decided to reopen the unit to outpatient services on Tuesday, November 7. These assurances were made on Monday evening. The dialysis center at the Korle Bu Teaching Hospital continues to remain closed to outpatients despite a directive from the Ministry of Health for it to be opened immediately. However, the ministry is confident that that directive will be adhered to. For Citi News, my name is Eno Safo.